Alright, so muscles of the head and neck, TMJ, which are temporal mandibular joint, and the sinuses. Alright, so again, all the bones and extensions and processes and protuberance and annulus, all those have a purpose in the skull and in your head. Okay, so muscles of mastication, chewing, masticatory muscles are chewing muscles. Okay. There are 4 principal pairs of muscles responsible for chewing. Temporal muscles. Where do you think the temporal muscles attach? Temporal bone. Okay, origin. Origin means where they come from. Insertion, where they end, where they insert. Okay, that you don't really have to know. Just we'll talk about the muscles. Don't worry about the origin, the insertion. We're going to cover it, and then innervation is where what nerve actually gives them sensation or what makes them move. So that we don't have to worry about. Just I'll tell you what you need to know. So the temporal muscle, origin is the temporal fossa of the temporal bone, insertion, the coronoid process of the mandible. Where's the coronoid process of the mandible? Which one was it? What's a process?
Extended.
Yeah, so the coronoid process, which is the coronoid process?
The anterior.
The horn.
Oh.
And this one was the condyle. Okay, so again, the process it inserts right on the coronoid process. So the temporal muscle, the largest muscle of mastication, broad and fan shaped. Okay, that's the question. Which muscle is broad and fan shaped? I guarantee you one of you will get it wrong.
I feel like you guys make bets behind the back.
Oh no, it's because I'm telling you the answers and still.
Like,
So like, she's gonna
Alyssa's
get that
gonna
one
get
wrong
around
and that
this
one
week.
wrong.
I know it.
Still good. I guess.
And then go, yeah, I told you.
Told you. Put a happy face. Largest muscle of mastication, broad and fan shaped, located on the lateral surface of the skull. Again, the temporal muscle. This muscle is functionally designed for movement rather than power. Okay, so it just helps your jaw move, doesn't really have too much strength. Main function is to elevate the mandible and close your jaw. Okay, again, large fan shaped, and you've got pictures in many pretty colors. There you go, outline them. Okay, so temporal muscle. And here's the coronoid process, and that's where it attaches. Originates, inserts. What's this fossa called? Glenoid fossa. Okay, masseters. Masseter muscles. These are important muscles. The most superficial muscle closest to the face. Origin, zygomatic arch. Again, the zygoma right here, your cheek, inserts external surface of the mandible. So from the zygomatic arch to the external surface of the mandible. So here's the zygomatic arch to the external surface of the mandible. So it goes from here to here. Consists of 2 portions, a superficial, larger of the 2 portions, direction muscle downward and backward, protracts the jaw, and a deep portion, smaller but more muscular, direction of the muscle fibers is downward and forward, retract the jaw, composed of long parallel fibers. This is what's important. It's a muscle of great power and fast contractibility, capable of exerting great force. This is what gives you your biting power. Okay, so your masseter muscle is the strong muscle. Okay, patients that come in kind of with a square face, and sometimes they can't even open wide enough because their masseter muscles are so strong. I mean, you're literally fighting them to open their mouth, and you can see them. They got like fat cheeks, and their muscles are like They've been working out. Overall function, closes the mouth. Okay, this guy right here. That's a big muscle that comes right here. Again, from the zygomatic arch down and around the angle of the mandible there. And then again, it's got a superficial and an inside portion. Okay, so far, those are the two muscles. Fan-shaped is your temporal and your masseter muscle. Pterygoids. Internal medial pterygoid, or medial and internal are the same. Some books will say the medial pterygoid, some books will say the internal pterygoid, but they're the same muscle. Origin, maxillary tuberosity. Again, the tuberosity is the back of your maxilla right here, the bump. Lateral pterygoid plate on the side of the sphenoid bone there, and the palatine bone up in here on the palate. Inserts medial surface of the ramus and the angle of the mandible. Okay, the angle of the mandible is out here. Put my head together. Has a rectangular shape, powerful, works in combination with the masseter muscle. Internal structure is fleshy and tendinous. Fibers that are arranged at an angle comparison to the direction of the muscle. This braid-like arrangement increases the power of the muscle. This is the important part. The muscle suspends the angle of the mandible in a sling. So it's sometimes referred to as the mandibular sling. So this muscle and the masseter muscle, they wrap around this guy and suspend this jaw like your arm in a sling. So remember that the medial pterygoid is the one that's the sling, because that's on the test. The external pterygoid, that one does not have a sling. Okay, the medial is the one with a sling. Don't get them confused. Origin, sphenoid, lateral pterygoid plate, inserts the neck of the condyloid process. Again, this is the condyloid, which is the back one. Okay, condyle, not coronoid, condyloid. Don't get those confused. Short, thick muscle that arises with two heads. That's the important thing about the external one. It's got two bellies, two heads. Upper head fibers run horizontally. Lower head fibers run upward and downward. This you don't need to know. This you need to know. Okay, some of you are saying that, oh, I'm reading too much into this and it wasn't on the test.
I stopped highlighting so much.
So just
This
like
is what
the
you
one
need
on the
to know.
side.
It's got two heads, period. Okay.
Just that. Yeah.
You don't need to know it's got an upper head and a lower head and they run horizontally. Okay? Make it easy for yourself. Where the star is, that's what you need to know. Okay? Take good notes. Get good flashcards. Okay, if you got good flashcards, if I'm feeling good next week, you may get to use those on the test. Because this is a tough test. There's a lot of information. Okay, so make good flashcards, and we may let you use the notes if you guys are struggling with it. No books, you can't open your books, but make flashcards. Okay, writing things down makes you remember things. Okay, highlighting, yeah. I mean, it's good that you can read it, but the actual writing is what makes you.
That's what I like about Quizlet. Like it makes you actually type.
Well, I
it
can't
in.
let you use Quizlet.
Well, no, I'm just saying, obviously. But when you do the Quizlet, it makes you type it out
Yeah.
instead of like just letting you click it.
Yeah.
So we'll have
It's annoying.
we'll have
It works.
a written Quizlet.
Written Quizlet.
Okay, so short, thick muscle arises with two heads. A muscle of function is to open and protrude the jaw. Okay, so again, you've got one head going that way, and then you've got this other head going this way, and then you've got the medial on the other side. I should wait for my arrows. Forget where I put arrows or not. Okay, now this is a different drawing, but again, here's the two heads. One going upper and lower. And then this is the medial or internal pterygoid. Cervical muscles. cervical. Where's the cervical muscle? Okay, is your neck. Okay, sternocleidomastoid muscle. Sterno is your sternum. Cleidomastoid muscle. Okay, origin, your clavicle, lateral surface of the sternum. Insertion, posterior and inferior to the external acoustic meatus temporal bone. So this guy right here. Function, divides the neck into an anterior and posterior cervical triangle, also used as a landmark within the neck when examining that region. So if you come and see when we're doing initial exams, we're feeling along this muscle right here. Okay, I can't get it to this guy. Okay, we're all, you get lymph nodes and to flare up in that area. Okay, so it's this muscle right here from the external, outside of the external auditory meatus here, and it comes to the medial of the sternum and part of the clavicle. Bless you. Okay, so it's that, you can see that muscle right there. I mean, you can see it coming down in towards the sternum, and the other part goes onto the clavicle. Okay, and so that's the muscle that we feel for any inflammation of lymph nodes, or you can also try to feel the carotid. Thank you. Any calcifications in the carotid artery. Trapezius muscles for any bodybuilders. Okay. Origin, external surface of the occipital bone. Okay, so it attaches back in here. The occipital bone. Insertion, part of the scapula, which is your shoulder blade, and the lateral third of the clavicle. Okay. Function, lifts the clavicle and the scapula, which is the shoulder blade, when shoulders are shrugged, so it helps you that. Okay, so here's kind of where it is. Trapezius. This guy here, and it goes up to the base of the occipital bone. And the clavicle is down underneath. Okay, and this was Dr. Cervantes last Saturday. Caught him at the gym.
I'm just
there.
retaining a little water today.
Okay, so here it is, the base. You can see at the base of the skull right here, and it comes and it's this guy. All right, muscles of facial expression. Okay, so these are the facial muscles. Paired muscles that have either their origins in bone and insert into the skin. Okay, orbicularis oris. Orbicularis oris. Origin, muscle fiber surrounding the mouth, inserts the skin and angles of the mouth. Innervation, the facial nerve function, closes and puckers the lips, can aid in speaking and chewing by pressing lips against the teeth. Okay, so it's this muscle right here, around the lips, around the mouth. This guy. Dr. Cervantes. Okay, and it does that. Puckers the lips. Okay? That helps you smooch. Okay, buccinator muscle. Buccinator. Origin, posterior alveolar process of the maxilla. Again, posterior alveolar process. Again, it's the word alveoli. Again, the alveolar process is an extension of the maxillary down where the teeth are. And the mandible. Insertion, angle of the mouth, fibers of the orbicularis oris. Okay, so it goes to the corner of the mouth and into the fibers of the other muscle that goes around your mouth. Innervation, the facial nerve function, compresses the cheeks to teeth and retract the angles of the mouth. So you do this. Okay, so this guy coming right through here, again, goes into the fibers of the orbicularis oris muscle and the angle of the mouth. And it helps you play the trumpet, like Louis Armstrong there. Okay, so you can see that muscle right in here helps him tighten his embouchure there so that he can play that trumpet and hit those high notes. So you'll just tighten this guy here to hit those high notes. Buccinator. Mentalis, okay, we talked about the mental protuberance there. Again, the mental muscle is this guy. And this muscle, when you're working on those lower front teeth, some patients, whew, they got it so tight you can't even pull the lip down. And you're holding back with the air water syringe, and I'm pulling them, and it's slippery, and you can't get your handpiece in there because they've got their muscle, it's so tight. And you'll see it kind of shrivel up like that, and go like that. See, it's a strong muscle, or just being right here. Again, incisive fossa of the mandible, inserts the skin of the chin, facial nerve, pushes the lower lip, and pushes hard, races and wrinkles the skin of the chin. Okay, so it's this muscle right in here. And it does that. Okay, and it's strong. And sometimes until you get in there trying to pull a lip down that's doing this, it's hard. Zygomatic. Okay, zygomatic, again, it's probably in the zygoma, zygomatic arch. Origin, zygomatic bone. Insertion into the fibers of the orbicularis oris, again, around the mouth. Innervation, the facial nerve function, brings the angles of the mouth upward and backwards as in smiling or laughing. Okay, so this is an important one to have, because we want happy people. See, like that. Makes you smile. Okay, so this guy right here pulls your smile up. From the zygoma, from this bone right here in your cheekbones, obviously it's going to go up, make you smile. Like that. Or like that. And this one's all what she's using also her buccinator. See, she's kind of tightening right there. Muscles of the floor of the mouth. Mylohyoid, okay? Mylohyoid is one for the tongue, made up of left and right posterior portions, joined at the midline. Mylohyoid line of the mandible, okay? Mylohyoid line, you really can't see it, but it's this guy in here, inside the mandible. Insertion, the body of the hyoid bone is kind of a loose bone in your neck right here. It's a little floating bone, and it's attached by muscles on the top and muscles on the bottom, and it just goes wherever it's pulled. Innervation, trigeminal nerve function, elevates the tongue and lowers the jaw and forms the floor of the mouth. Okay, so there's an arrow there because that's the condyle. This is the coronoid, condyloid. So this is the muscle right here. Forms the floor of the mouth. Here's the hyoid bone, this little floating bone, and this is another muscle here. But this kind of tent right here, this is the hyoid bone. Again, it goes from the side of the jaw, inside of the jaw, the hyoid part of the jaw, and comes and it joins in the middle. There's a left and a right, or a right and a left, however you're looking at it, and it hooks onto this hyoid bone down at the bottom. And it kind of tugs on the tongue to pull it back, and he moves the jaw, lower jaw. Okay, digastric muscle, anterior belly digastric muscle, posterior belly mastoid process of the temporal bone. Insertion, body of the great horn of the hyoid bone. Anterior belly trigeminal, posterior belly facial function, forms a submandibular triangle with the mandible on each side of the neck, opens and closes the jaw. Okay, so digastric muscle, and it goes from here and through, and the other belly. Stylohyoid muscle, styloid bone, hyoid bone, styloid process of the temporal bone. Insertion, body of the hyoid bone, facial nerve, function for swallowing. Okay, the stylohyoid bone. temporal mandibular joint, TMJ. Everybody comes in and says, I've got TMJ. Everybody has TMJ, that's the joint. You've got temporal mandibular dysfunction or temporal mandibular syndrome. That's when it's acting up. When your TMJ is hurting, you don't have TMJ, you've got temporal mandibular dysfunction or syndrome. But everybody says, oh, I've got TMJ. Everybody's got TMJ. Connects the maxillary and mandibular jaws. Okay? So the joint connects the mandibular jaw and the maxillary jaw. Two bones that form the joint. There's a temporal bone and the mandibular bone, located between the articular tubercle and the glenoid fossa. Okay, the articular tubercle is this bump right here, and then the glenoid fossa. Interarticular disc, this is what is between the condyle and the glenoid fossa, and it's basically a shock absorber that keeps the condyle lubricated and allows it to slide forward and upward and backward and do everything that it does. And the two cavities are filled with synovial fluid. That's a fluid you need to know because that's on the test. Synovial fluid. So the disc itself is a disc that lies on the condyle, made of tough fibrous tissue, divides the space between the glenoid fossa and the condyle into two cavities. So it's kind of sandwiched in between the condyle and the temporal bone. So if you look at it here, here's the glenoid fossa, the articular tubercle. Okay, here's the condyle, the head of the condyle, the jaw's coming down this way. We're looking at this part right here. Here's the neck of the condyle. Here's the condyle, and here's the fibrous disc. And then this blue area and this blue area would be the synovial fluid. And if you, this is just kind of split down the middle, but it's a sac. It goes all the way around. It's like a protective sac that goes all the way around that joint. Just another look at it. Three osseous portions that make up the TMJ. What's osseous mean?
Build bone.
Bone. Three osseous portions, so three bone portions that make up the joint. You have the glenoid fossa, that's the top part, top bone. Okay, the glenoid fossa is in the temporal bone, which is the depression. Okay, this guy. Again, it's going to come up over and over, and on the test it's over and over, so know where the glenoid fossa is, know what it is. Articular tubercle, a raised portion of the temporal bone just anterior to the glenoid fossa. Okay. Just anterior to the glenoid fossa, articular tubercle. Condyloid process of the mandible. The condyloid process, again, is an extension within the glenoid fossa, which with the interarticular disc separating the bones. The mandible is attached to the cranium by the ligaments of this joint. The joint is capable of a hinge and gliding actions of the mouth. Okay, so the condyloid process, this guy here, within the glenoid fossa, and it's got ligaments that attach all the way around, and it's encapsulated with synovial fluid, and it's got ligaments, and when you take jaw, you take a punch, you go this way, so this ligaments here, they stretch out. And the more they stretch, that's when some patients will start to complain about clicking or popping or locking, because they've done some sort of damage to that disc or the ligament, and they open and it clicks and pops. And, okay. So then we send them to Dr. Cueva, who's a TMJ specialist in head and neck pain. Because TMJ patients, temporal mandibular joint patients, are difficult patients. Because the joint, when you start messing around with the joint, it's kind of very gray, you've got to be really conservative. Just night guards and try to recapture it with certain appliances to help the ligaments readjust and keep the disc where it belongs instead of sliding much, unfortunately. And they can do surgery, but you don't like surgery in the gym. All right, so those are the muscles. Any questions on the muscles? Tried to point out everything you need to know and no more. Okay? Don't
Yeah, 'cause
start,
that was a lot of information.
don't start putting everything you didn't highlight, don't learn. Okay, learn what you highlighted. Because if you learn everything, you're gonna not get everything. It's too much information, so I'm trying to give you the highlights of all the muscles and what you need to know, and that's what's on the test. Let's see, what did I, anything on the study guide that I didn't cover? So temporal muscle mass or internal pterygoid, external pterygoid, glenoid fossa, articular tubercle, meniscus, fibrous capsule, temporomandibular joint. Bones, temporal bone, frontal bone, occipital bone, parietal bone, nasal, mandibular. There's your test right there. All right, so paranasal sinuses. Now these are all the cavities in your head.
So are we, on the test, so we can have it, say we're gonna do just name
Yes.
on all this?
Yeah. Sinuses?
Or
Not sinus. Sinuses. Maybe they'll point to the maxillary sinus. I don't remember. But yeah, I'll tell you which ones are important on the sinuses. That one.
These three guys?
Yeah. Those two guys. Yeah. All right, so sinuses are air cavities in the bones above and on each side of the nasal cavities. These air cavities vary in size and in shape and are lined with a mucous membrane. Okay, so there's groups of sinuses. There's an anterior or a frontal group. Sinuses that open into the middle meatus. Okay, so you've got a frontal sinus. That's the one you get like sinus headache. That's the one that hurts right here, right above your eyes. And you've got a meatus is basically just like a channel inside the nose where they hear the sinus cavities. Okay, so this is kind of what it looks like. Here's the middle meatus on the sinus there. Okay, maxillary sinus. So this is the anterior group. Maxillary sinus, largest accessory sinus of the nose, located in the body of the maxilla. Largest accessory sinus of the nose located on the body of the maxilla. Where are you going to see the maxillary sinus? On an x-ray. On an x-ray? Maxillary sinus?
They're right gonna be
The upper jaw.
Upper jaw? Well, which films though? When you're taking a full mouth series, where are you going to see the maxillary sinus?
molars.
Maxillary molars. Remember the maxillary molars. 3 roots going up into the maxillary sinus.
Sinus cavity.
Okay. Sometimes you take an anterior PA, you'll see sometimes the cavity there, but for sure you're going to see it on your molars, PAs. Situated below the floor of the nose, the floor of the sinus is sometimes perforated with the apices of some maxillary teeth. Okay, so here's the maxillary sinus, but this picture is, this is where it shows them, but again, it's further back in the head, not right in the front. Frontal sinus, located behind the superciliary arch which is just above the eyebrow. So superciliary means just above the eyebrow. It drains through the frontal nasal duct into the main cavity of the middle meatus. So it drains through the frontal nasal duct into the main cavity of the middle meatus, the canal there. Okay, so here are the maxillary maxillary or a frontal sinus above the ciliary arch. Anterior and middle ethmoid cells. These are just thin-walled cavities. Anterior middle ethmoid cells are thin-walled cavities. That's what you need to know. Located between the upper portions of the nasal sinus and the orbits. Okay, so the questions on these, it's just, it'll tell you, it'll say anterior and middle ethmoid cells, and it'll give you this as one of the choices, and other ones that are wrong. Okay, so it'll say are numerous thin-walled cavities in the front, or are members of the frontal sinuses, are located between the upper portions of the nasal sinus and the orbits. Okay. Yeah. Posterior group. Okay, these are the back sinuses. Sphenoidal, again the sphenoid bone. Rear sinuses, located within the body of the sphenoid. Very large and can extend into the great wing of the sphenoid or the roots of the pterygoid process. Posterior ethmoid cells. Open onto the superior meatus under the superior nasal concha. Okay, so posterior ethmoid cells, and then we had anterior ethmoid cells, which drain into the middle meatus. So posterior ethmoid cells open into the superior meatus under the superior nasal concha. So know that difference. Anterior nasal ethmoid cells drain into the middle meatus. Posterior ethmoid cells into the superior meatus under the superior nasal concha. Okay, so you got your frontal ethmoid cells here, and you got your ethmoid and sphenoid in the back. Sinusitis. Okay, what's sinusitis? What's itis mean? Not infection. Close. Inflammation. Okay. Anything that ends with itis means it's inflamed. Bursitis, inflammation of the bursa. Sinusitis, inflammation of the sinus. Gingivitis, inflammation of the gingiva. Okay, all it means is inflammation. Okay, so a bacterial infection or inflammation of the mucous membranes that line the sinuses. That's what sinusitis means, although it's an inflammation. It's a bacterial infection or inflammation of the mucous membranes that line the sinuses. Know the symptoms. Pressure buildup due to exudate, accumulation. Okay, this is when you get a runny nose, and you got pressure in your sinus, and you can't breathe, and your eyes hurt, and you've got watery eyes. Nasal discharge. Pain in the area of the sinuses, so you tap right here. Pain of the maxillary teeth, and this we see a lot. Patients will come in and they say they've got a toothache. Okay, you tap on one side and you tap on the other side, and the upper teeth hurt. Okay, and we can't see anything on an x-ray. There's no cavities, no big fillings, we don't see anything. Usually we'll rule it out first as a maxillary infection or a sinusitis. Maybe give them some antibiotics and decongestants, and a lot of times that's what it is. It's just a sinusitis, but they'll say that it's their teeth. So we see that a lot. Alrighty. Questions? Again, make good flashcards. If you guys behave, you may get to use them.
Because we're so naughty.
So naughty.
We're little troublemakers.
You can't share flashcards, so make your own.
Can we share on the Quizlet?
You share the
Except
Quizlet.
for my quadrants, though, I got those all backwards because.
On your Quizlet, they're backwards?
Well, because I was thinking we were reading
Because she's
adaptation, it was our
left-handed.
left and our right, not the patient left.
Patient.
And then we did the x-rays, and then it had it outlined like that. I said, well, I always thought that first, and that would make sense. But I'm left-handed, so he's up weird.
You are. All right, Doc, can we turn on the computer so we can have them go over mounting on the, turn the server on? All right, I kind of went through that pretty fast because we finished early. We can
I
go
know.
back and review everything. So
I'm
que-
okay.
Questions while he turns on the computers?
No, write it all out.
Concentrate on it.
Are you guys
Dissect
gonna
it.
upload this lecture online?
Yeah, I'll have
A little
Ron.
early, well,
He's like,
a little
no.
earlier
Yeah,
than
he did,
we-
he told me he's usually here Monday or Tuesday, he wants to get them up by Wednesday.
Yeah.
Yeah, that was a good one.
Yeah.
The last one was on.
And he was supposed to come in and he just
Yeah.
runs all around town doing stuff. He didn't come in till that morning and so.
I'm sorry, I'm bothering you today.
Yeah.
I'll,
Sorry, I won't bump you in the
Yeah,
head.
so-
It helps me a lot. So I sit
I
there
should
and
have
I'll
brought
watch
water
it.
today, I didn't think
Yeah,
about
I
it.
thought- I thought
Normally
it
I'm
refreshes
always looking
my
for
brain.
water, but
Yeah, it's okay.
turn off the.
Get that baby water.
One of those videos was like 2 hours long last time.